Glasses, here we go. And now, I like to call this person a local hero. We're so lucky to have Dr. Mitchell, Ian Mitchell. He is a beloved emergency physician right here in Kamloops. He's always raising his voice for others. Some of you might even know him from his viral video. He's the one that had over 1 million views from our previous forum. And so I guess that means you're officially a rock star in my books. Dr. Mitchell is a clinical associate professor at UBC's Department of Emergency Medicine, a co-investigator in groundbreaking psilocybin research for major depression, and has a great background in pharmacology. Throughout his career, he stayed close to the world of toxicology, leading projects focused on naloxone, cannabis, ketamine, and psilocybin. He's a natural educator and a mentor, always approachable, always passionate. He's come to a few of my forums and talks and classes, and I really appreciate him. And I personally learn something new from him every single time I hear him speak. So I'd like to welcome Dr. Ian Mitchell. Here's your clicker.
Thank you so much. I think that's quite the introduction there. I'm Ian Mitchell with a name like Mitchell from Northern Ireland. You know that I'm a Protestant originally from Scotland, and so the Mitchells would be part of the Protestant invasion that colonized Northern Ireland for 200 years, and then we immigrated to Canada. So carrying on a colonial tradition, which is kind of part of being British. But my family is also a family of healers. My father was a surgeon. His father was a family doctor. Before him was a pharmacist. My mother and wife are both nurses, and my teenage children are both seeking their own healthcare journey. And I've been very happy to have come here. Willing or not, I guess I had not much choice in the matter, but grateful to grow up and now work in this lovely area, originally of Secwepemc area. So this talk is really focused mostly on marketing versus evidence-based medicine. And when I was doing my bachelor's degree, came to third year, time to pick a major, and I was hoping to do physiology, but my grades weren't good enough. So there's a group next door that said, why don't you go off and maybe study pharmacology? And I said, well, what's that? And they said, well, that's the study of how drugs affect animals and people. And I'm like, you can do that? And I was sold. And so I've been studying drugs for the last 40 years, and this is kind of a bit of a distillation of kind of knowledge and the way I would look at it walking through the BC cannabis store. So hopefully just a little guide to some of the things you find there, and some of the evidence behind some of these sales. So when we talk about the BC cannabis store is a recreational store. It does not provide medical information. It's not supposed to sell medical product. That's for the medical cannabis field. Although the medical cannabis field is kind of shrinking a lot over the last few years. Among other reasons, there's very few doctors around, so if it's harder to find a doctor, you can't get an authorization. And obviously, in a recreational world, THC really drives sales, and we have pretty good evidence that THC helps with pain and helps with sleep, although honestly not great evidence, moderate I would say. But these stores, they also sell CBD, CBN, CBG, and THCV. And those we generally think of as non-intoxicating, not psychoactive necessarily chemicals. So, how does that fit into recreation? And how are they sold? On what basis are they sold? Are they, what's the fun you get out of them? What's the motto? So I just kind of want to talk a little bit about what we see there and some of the evidence behind all these things. So first off, when you walk through the store, you're going to see different sections. Okay, you're going to see indica versus sativa versus hybrid. And BC Cannabis Store kind of says, well, generally indica It's the one that puts you into couch. Higher in THC, and also contains CBD. And that's just not true. Certainly in the way things are currently. And there's a bit of a backstory behind that. In the 70s, people were looking for a strain to breed with current strains available in North America, or predominantly grown in Mexico, and were not very cold tolerant. So people went over to Afghanistan, sowed seeds into the seams of their clothing, flew back and started to grow indica seeds, which at that time probably did have higher levels of CBD. But currently, there's been so much interbreeding between all these. Study after study has shown that there's no real chemical difference between plants that come from these two varieties, no matter how they're assigned. And there's been breeds, strains that have won the best indica one year and won the best sativa a different year. And no one's really been able to provide a mechanism for how this would happen. You know, what is it about the current sativa versus indica plants that makes them different? Certainly the CBD, THC are equivalent. So then you break it down, well, maybe it's the terpenes. And this has been one of the thoughts for a while, that maybe it was a terpene called myrcene that was responsible for making people sleepy. But myrcene's in mangoes, it's in lemongrass, and those aren't things that are, you know, really known for knocking you out. And people are very much generally attuned to things that make you sleepy. You know, there's lots of things like kava and all kinds of things around the world that people are like, wow, this makes you sleepy, great. So this is really historical interest alone. So none of this should be paid any attention to. There's no studies that support this as far as these two different plants having different effects on people. We'd love to do that research in a proper way. So far, it hasn't been done. So the next thing I want to talk about is CBD. And CBD, that's $2.99. That's $2.99 for 100 milligrams. Well, a pretty good price overall. Generally, CBD is more expensive than THC because it takes more plant matter to make it. It's just hard to extract, so it costs quite a bit more. And that's one of the issues with CBD, is it does tend to cost a lot more. So what does it do, though? You know, what does CBD do according to the scientific literature? We do know that it's great for seizures, and that was one of the things you didn't really need the scientific evidence for, because there were these kids that were born with a seizure disorder, generally Lennox-Gastaut syndrome, very difficult to control, you know, dozens of seizures a day. And then there was this extract called Charlotte's Web that people started using, and it would stop those seizures. And you know, you don't really need a study. That's evidence right on FAS that this works. And subsequent studies confirm this. And now you can buy CBD in a pharmacologically pure preparation. You can buy it in kind of tablets, capsules, whatever, and take. So that is, you know, unquestionably valid science that backs up that activity. But most people buying CBD from the store, they're not taking it for stopping seizures. They're taking it for relaxation. And there's some animal studies that have looked at that and shown that generally it does seem to reduce anxiety somewhat in animals. But the human studies have just not been able to replicate that. And there's studies where that people are being given 150, 300, 600 milligrams. Big doses. Doses that most people are not taking anywhere close to. And they're not really finding good evidence of anti-anxiety. There's lots of animal evidence looking at anti-inflammatory effect, but very poor in people. People say, well, how much would I take for arthritis? And I said, well, you know, the only thing I have to go on dosage is, you know, in a dog study, they use 2 milligrams per kilo. But, you know, I don't know what it would be in people. We don't have those studies. There's lots of basic research. So that's kind of what I call the dosage dilemma, you know, all these studies. So, you know, there's studies where, okay, you should take CBD before going out in public speaking, okay? But that study, 600 milligrams of CBD, and, you know, that's 2 of those big gummies there. right? So, how much more do you eat? And you're going to take that all the time? That's a lot. Plus, when you get up to that dosage, there can be some actual liver issues. So generally, that whole thing isn't clear. Another thing that was long thought of and backed up by earlier research was about CBD decreasing the high from THC. And earlier research did support this, but subsequent research has been a lot iffier and really not demonstrated the same thing. And one of the things they've done several studies looking at driving ability, and really CBD given in conjunction with THC doesn't seem to affect the impairment. You're still impaired. So that's a very kind of direct look at something that didn't show a positive effect, and it doesn't mean that there aren't more subjective effects that are present. But we haven't really teased that out with any good research. Next in the line is CBN. And CBN, again, the cannabis store, they're not supposed to market medical, but you go look at CBN products and it's, bedtime blueberry, drowsy diamonds. It's all very kind of, the names are definitely suggestive that this will make you sleepy. And this came on the market 2021, 2022, allegedly based on a study out of Australia, but the study actually gave CBN in combination with generally a dose of 10 to 20 milligrams of THC at night. So not just testing CBN, and that's one of the issues with some of the research, is they test different formulations which have a multiple cannabinoids, and you're not sure which one is actually producing the effect. So CBN overall, in rats does seem to cause some sedation, but in people, there was one particularly good study, the claim is of sleep improvement. This is one of the studies that was done, and one of the better ones done from last year. And this is really what we want to see. We want to see a randomized, double-blind, placebo-controlled study where people don't know if they're getting the active ingredient or a placebo. And the investigators don't know either, so that's the best way to test. And that's typically how we test drugs in general. And when you do a study like this, you really identify one outcome that you're looking for. And in this study, it was sleep quality. And then you have a bunch of other things. Well, did they wake up as much? Did they toss and turn? What were other factors involved? On the primary outcome for this study, it did not show any improvement. So we would call that a negative study, and that's still one of the best ones that's been done. Now, they did show some small improvement in some other areas, and other areas that didn't show improvement. So, it's possible there's an effect, but we're trying to show a strong effect here, and it's just not showing up. The next one is CBG, and CBG I think people know maybe the least about. It's just kind of not been around very much. They think it may have effects on metabolism and anxiety. And in one study, I think the one study we have is 34 people taking 20 milligrams of CBG. And again, some improvement in anxiety, but not in other parts of mood. So again, varying results from this. And that's kind of the sum total of human research on effect that I'm able to find. So, that kind of comes out to, well, you can try it. It might work and it might not, which that doesn't seem like the standard to which we should have here. Especially for a drug. And when you look at the, kind of some of the research, this is what they'll say. These are all the things that it does. It's neuroprotective, it's anti-inflammatory, it's antihypertensive, it causes metabolic, this is what the cannabinoid system regulates, but it doesn't necessarily mean that this drug does those things. And then THCV, it's kind of a newcomer as well. You can get those, this is a THCV and THC chew. So again, you're not just getting the THC effect, you're getting both of them. And what does that do? There's one study where they used a combination formulation of THCV and CBD to grow hair. And actually did as well as minoxidil, Rogaine. So, but I haven't seen that on the market yet. And certainly I don't know what I want to ground up the gummies and rub in my hair. That seems a bit bit much there. But again, there's certainly potential out there. And when you look at how successful Rogaine has been, and if you've got a study saying, well, THCV can do as well and grow hair, well, how come we aren't seeing bigger studies being done? How come this isn't, you know, the new big marketing thing? So THC, overall weight loss, neuroprotection is a thing, but really there's very little human research. Interestingly, there's a product marketed in America called High Be Gone, which is a THCV concentrate. And you're supposed to be able to take this and it will take away your high. So if you've had too much, whatever, you can take some THCV and that'll just be great. And that's, you know, that's maybe kind of a thing that could happen. Apparently THCV is an antagonist, so it will kick THC off the receptors. But the research is pretty spotty, and there's one study that looked at the effects of this, and kind of some people said it helped, and some people said it really didn't. So again, certainly not a guarantee, and probably not something that's quite ready for prime time. I think you also want to be respectful of THC antagonists, because there was a medication called rimonabant, and that was being researched for appetite control, because if you get the munchies and you block those THC receptors, that should involve you eating less food. Unfortunately, people kind of like some of their natural THC molecules, and that drug made people kind of anxious and depressed and suicidal, so that's kind of gone off the market. So that's kind of what you can buy generally in the store. And for a lot of it, I'm like, well, why are people taking this? Because we don't know much about it, any of these things. We have safety research that shows it's safe, and that's okay. But generally, when you go to the drugstore, you're looking for something that works. And you could go to the supplement aisle, which is kind of like what we're dealing with here, where it's like, oh, take this herb or whatever, and it might make you feel better. But we should be better than that. But there are some problems. You know, who benefits? Who benefits if this research is done? Do the pharmaceutical companies benefit? Do the cannabis companies benefit? Well, only if it's really positive. If the study's negative, well, they're not going to sell any more of this stuff. So it's a long-term investment that may well end up poorly for them. So there's not much reason for them to do those studies. Really, it should be governments doing this kind of basic research, but you know, that's been an issue for a long time, and certainly in America, there's no research happening ongoing. I mentioned that we're dealing with a shrinking medical market, so there's less reason for kind of people to do this when you could just take it. There's no money, and there's still big research barriers. Anytime you're involving cannabis and people with research, there's a lot of extra steps that have to be involved. There's more security. There's just a whole kind of other level of difficulty in conducting that research. So I think ultimately that's kind of what I wanted to say. You know, I think we can do better than have cannabis be the new herbalism. I'd love to see far more research being done to say, well, what does that CBN do? What does the CBG? Do these work at all? There's a whole big avalanche of research. It just hasn't even been looked into yet. So that's just my plea for the future. But I hope this was helpful in terms of kind of educating you a bit as far as being in the stores and what you might find there. Thank you so much.
Thank you, Dr. Mitchell. I can't imagine all the questions you must get from your patients about this and how you have to answer. Thank you for doing that.